In this presentation, we will review the pharmacology of reversal of neuromuscular blockade with emphasis on Sugammadex. Sugammadex has been approved for use within University of Washington medicine, limited to reversal of block deeper than a train of 4 count of 4. In other words, in the presence of 0 to 3 twitches. If there are 4 twitches at the time of reversal, neostigmine should be used. If quantitative twitch monitoring is available and the train of 4 ratio is greater than or equal to 0.9, no reversal is necessary. Sugammadex works by binding rocuronium or vecuronium, after which the complex is cleared by the kidney. Sugammadex should not be used in patients with creatinine clearance less than 30 mL per minute. The dose of Sugammadex depends upon the train of 4 count. If the count is 2, 3, or 4, the dose is 2 milligrams per kilo. If the train of 4 count is 0 or 1, the dose is 4 milligrams per kilo. The dose for reversal immediately following an intubation dose of muscle relaxant is 16 milligrams per kilo. It is important to determine the train of 4 with ulnar nerve stimulation and thumb twitch. The twitch should not be obtained from the face or other locations. It is important to realize that the fingers may twitch due to direct forearm muscle stimulation at a time when there is no thumb twitch at all, as shown in this video. The train of 4 count should be obtained with ulnar nerve stimulation and thumb twitch only. The twitch assessment prior to reversal must be recorded in DocuSys. There will be a hard stop requirement that this assessment be recorded prior to closing the anesthesia record. If the train of 4 count is 0, it is necessary to assess the post-tetanic count. The next video shows how to do this.
Okay, this patient is being monitored with train of 4 right now. We have it in the repeat train of 4 mode. We'll see the light pulse up there, and there are no twitches. We're going to do a post-tetanic count. And the way we do that is we first give a 50 hertz tetanus for 5 seconds. 5 seconds, 50 hertz. After which we do a pause for 3 seconds, and then we go to single twitch stimulation, and we count these twitches. I saw 3, 5, 6, 7, 8, 9, 10, 11, 12. Okay, so she has a fairly high post-tetanic count, PTC, of about 15. Actually, I can still see it twitch a little bit. I'm not sure I'm going to count those weak twitches.
Sugammadex should be dosed based on total body weight, not ideal body weight. Female patients using any form of hormonal birth control should use alternative birth control for 1 week following Sugammadex. There will be an order in ORCA to trigger written discharge instructions for such patients. The next slide shows an example of discharge instructions. Specific instructions for writing an ORCA order to activate Sugammadex discharge instructions will be distributed when available. Other caveats pertaining to Sugammadex are shown here. Sugammadex is not intended to replace neostigmine. When a train of 4 count of 4 is present, neostigmine should be used. The dose depends upon whether or not there is fade, which is determined subjectively unless a quantitative nerve stimulator is available. Neostigmine is dosed based on ideal body weight, whereas Sugammadex is dosed based on total body weight. The dose of neostigmine with a train of 4 count of 4 and no fade is 15 to 25 mics per kilo, or about 1.5 milligrams for a 70 kilo person. The dose if fade is present is 40 micrograms per kilogram, or about 3 milligrams for a 70 kilogram person. As noted previously, if the train of 4 count is 2 or 3, the dose of Sugammadex is 2 milligrams per kilo. If the train of 4 count is 0 or 1, and the post-tetanic count is 1 or more, the dose is 4 milligrams per kilogram. Currently, the price of neostigmine in the United States is an order of magnitude greater than the historical price, which is a few dollars. The price of reversal with neostigmine and glycopyrrolate is similar to the price of a 2 milligram per kilo dose of Sugammadex, assuming the patient is 100 kilograms or less. The price of neostigmine might revert to the historical norm at some time in the future. If it does, then Sugammadex will be vastly more expensive than neostigmine. Our goal should be to get to the point of reversal with 4 twitches present whenever possible, thus minimizing the need for Sugammadex. Here are some final recommendations for management of neuromuscular blocking drugs. In general, neuromuscular blocking drugs should be used to facilitate intubation and provide surgical exposure. Using neuromuscular blocking drugs to prevent movement or breathing is probably less effective than using anesthetic drugs such as opioids, propofol, and inhalational agents to prevent movement or breathing. Appropriate use of neuromuscular blocking drugs can help to prevent postoperative residual neuromuscular blockade and reduce the cost of reversal drugs.